Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rupa KG. She has done MBBS and MD from BMC and DNB Neurology from Manipal, and she has had a brilliant academic career. And she is a fellow of American Academy of Neurology. And apart from that, especially she has worked in the stroke as well as epilepsy and dementia in the patients. More than that, she has focused on prevention and bringing the awareness among the people by writing a book called as Decoding Headache in Women. Headache is not only in women, it is both in women as well as men. But however, let us welcome Rupa. Welcome, Rupa.
Thank you, madam. Thank you.
It's a pleasure to have you on our show. What is important is, they say Jaisa and Vaisa Man. Jaisa Van, Vaisa Tan. That means whatever we eat, it has an impact on the brain, and the brain in turn has got impact on our health. We all used to think that brain, heart, and the body axis, but now you are talking about the gut-brain axis. What is this gut-brain axis? Please let us know.
So it's a very interesting topic. In fact, the brain and the gut, it is not two separate organs. It is not so. It is both are connected with each other, and there is a constant interconnected. There is a bidirectional connections, in fact, between the brain and the gut, and from the gut towards the brain. So this bidirectional communication, it just indeed it says that there is a constant communication which is going on between the brain and the gut. So if we keep our gut happy, the brain will be happy. If we keep our mind calm,
And
relaxed, and
well.
practice good lifestyle, on the other hand, that with that our gut also will be happy. So this happiness is interconnected.
Correct. And satisfaction. But unfortunately, what is happening is nowadays the people, and especially youngsters, Gen Zs, are eating junk food. The junk food is stimulating their brain unwantedly, and that is causing the obesity in them and more of the diseases. What do you say about it?
Yeah, because the food what we eat, through that only, there are so many factors. See, the brain and the gut both are connected through the nervous system, vagus nerves, through the parasympathetic, sympathetic nervous systems, through the vagus nerve, and is also communicated through the immune system. And if we see 90%, 80% of this immune system is in the gut itself, through the GALT, that is gut-associated lymphoid tissues, we call it as. That's the body's defense mechanism. It is located in the gut. So if the gut is strong, if the defense is strong, the brain is also strong on the other side. So, and another way is through the neuroendocrinal hormones like the tryptophan, serotonin, dopamine, GABA, all these hormones, that this have a strong communications between the gut and the brain. And the serotonin, especially, which is responsible for the mood regulation, that 90%, 95% is produced in the gut itself. So it is connected via the nervous system. It is connected through the neuroendocrine system. It is connected through the immune pathway as well as circulatory system. Like if there is any gut infections, the infection spreads via the blood to the brain, and we see a lot of sepsis, septic encephalopathies, and all those tiredness, fatigue, mood disturbances,
and fatigue, and they get
behavioral
drowsiness and all
disturbances.
that behavioral. Yes, yeah, correct.
So through this pathway, there is a continuous communication is going on. So as you said, the Gen Z, or it may not be Gen Z. Now we see the lifestyle is more bad in them because they are don't have a controlled eating. We see that's why more of obesity, metabolic disorders, early diabetes, hypertensions, and we see a lot of mood disorders, ADHD. If we go back to the roots of ADHD, so it is again the gut. The gut is responsible for the ADHD. So it should start from the birth itself. Actually, the mode of delivery also decides. It's a vaginal delivery or it is a cesarean sections. One thing that also decides. A lot of genetic predisposition also decides about the future diseases. And there are a lot of social factors, environmental factors, eating habits in the culture, overall culture, that also have an impact on the brain. So all this has an overall impact on the brain. I had spoken about this, I think, in my YouTube about Hara Hachibu, that is Japanese Okinawa diet. They have 90%, they always make sure that 80% of their food is plant-based diet. So that will plant-based because it is high fibers and it is good for a gut and for digestion, everything overall. So and they go by seasonal diets.
High amount of antioxidants, all the plants, they have high oxidants. Yeah. And
And
there was a time when our grandmother and mother, when we were kids, they used to feed us with the spoon. They used to feed us curds and send whenever we are going to the school or for examination or something. Now, what have got the curds to do with the immunity or the gut and our brain?
again, curds, what we say, all these food, curds and fermented foods, pickles and all those things, they are the rich in probiotics.
Hmm.
So probiotics, again, it is nothing but a good bacteria. So we
Hmm.
need good bacteria. There is a gut microbiota, which
Hmm.
wherein 50 trillion bacteria are there in the gut. So
Hmm.
it can be both good bacteria, bad bacteria, but we need more of good bacteria. If we want good
Hmm.
bacteria, that should be based on these curds, fermented foods, and all those things which are rich. And all this, whatever we eat, high fiber, vegetables, and all those things.
Hmm.
Most important is curds and these probiotics, pro and prebiotics that will
Hmm.
mainly influence the good bacteria.
Okay. But nowadays, what is happening is on over the counter, people are buying antibiotic and they're doing the self-medication. And antibiotics are also spurious and substandard. And the antibiotics, they kill our
Good
intestinal
bacteria.
flora. So, what is your opinion on that?
Yeah, that's why unnecessary antibiotics should be avoided because antibiotics will destroy our good bacteria,
Hmm.
and the defense system is destroyed, in other words,
Hmm.
and they're
Hmm.
more prone for recurrent infections on a long run.
Hmm.
So that's why it is very
Okay.
important to avoid unnecessary bacteria for simple cold, common cold, and all those things. They should be managed with a simple conservative line of management
Like
rather than going for
kashaya or
antibiotics.
homemade remedies can
Homemade
be taken.
remedies,
Yeah, correct.
turmeric, ginger, kashaya,
Hmm.
such things we can use and then try to manage the simple cold or common cold or such infections rather than going with it, antibiotics with every episodes of simple cold.
Okay. And apart from that, what are the practical things, please tell us, our viewers, what to do, what not to do. Because many of the youngsters, they don't know what to eat and what not to eat. So tell us what are the good habits and the bad habits which have an impact on the gut as well as the brain.
It's a very important question. So it should start from the beginning, from the childhood itself, because all lesson is learned from home itself. From the children, we should make them cultivate that habit of having a home foods, healthy foods, rather than depending on the junk foods. Even in the home, if the junk food is kept, the child
Hmm.
tends to have more of junk foods. If you keep
Yes.
fruits, what is seen that they will eat. If you keep chips, French
Hmm.
fries, burger, they will eat that. Instead,
Hmm.
if you take it out and if you eat fruits, if you give them fruits or
Hmm.
some healthy nuts or something like dry fruits is kept on the table, dining table, they will eat that. So it starts from home. That habit should start from home itself. So first thing is going for the healthy diet, avoiding the processed foods and all these junk foods. So healthy diet, it should have more of probiotics and prebiotics. Like as I said,
Yes.
curds, fermented foods. Third, high fiber diet. All these green leafy vegetables, oats, and all
And
these are the
also
high fiber.
microgreens are also having more, and also the millets. They also contain very high fibers. Yeah.
These oats, millets, and all these are rich in high fibers, which is helpful for the digestion. So these things. And fourth thing, fatty foods and all should be avoided. Oily fatty foods, which we already know that.
And
And
especially the trans fats, the trans fats are not good. Like what we have in the cake and the biscuits and cookies, those trans fats, and that is not good for the health. Okay.
so hydration is also equally important. Good hydration of the over it is equal important for the overall good health. So
Hmm.
all these things should be adapted along with good exercise and sleep because many of this ADHD, they've tried a lifestyle. Those patients with an anxiety, they've tried changing their gut. I
Hmm.
mean the lifestyle. So
Hmm.
with the changing lifestyle itself, many of these diseases can be controlled. And
Yes.
many of this, if we go into the roots of this ADHD, if we anxiety, depression, Parkinson's disease, Alzheimer's disease, and if you go for this, even stroke, ischemic and hemorrhagic stroke, all these things, if you look back, it always starts from the gut itself.
Hmm.
So that is why it is very important to teach them what to eat. Healthy
Hmm.
foods, it should be pre and probiotics, high fiber content, hydrations, protein-rich diet, avoiding all this highly processed junk foods and all this flavored, colored, all these items which the tendency that they should break that cycle, what they have
Okay.
developed the habit overall this time.
Yes.
Plus exercise, good exercise and sleep. Sleep plays a
And
lot
no
of crucial
smoking
role.
and no spirit. That is also important.
No
Yes.
smoking, no alcohol, that also addictions and all those things. Unnecessary antibiotics should be avoided. All these things will have a good influence over the gut. And in other words, our brain also will be happy. If the gut is happy, our brain also will be happy.
And if the brain is happy, we are happy. Because the feel good hormones are released from the brain. Endorphin and neuropeptides are released from the brain. So unless the gut is happy, and that's why, in olden days, they used to give so much of importance for eating. And the mothers used to spend all their time in the kitchen itself. And nowadays, the mothers are not cooking and the children are not eating what is cooked at home. And as a result, the junk food that they're taking, and that is ruining their gut as well as the brain. And probably all these cockroaches are coming out because of the gut, the gut infestation, and that is causing their all abnormal thinking and abnormal behavior and all those things,
Lifestyle
erratic,
plays a lot of
yeah, yeah,
important role.
yeah, yes, correct, correct, correct. So thank you very much, Dr. Rupa, that you have told what to do, what not to do. And especially they have to start, say no to the junk food and smoking and spirit and sleeplessness. And say yes to the millets, greens, fruits, vegetables and curds. And that is the best way to have a happy gut and a happy brain. Thank you very much.
Thank you. Thank you, Madam. Thank you.
Okay.